infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey, everybody, and welcome to today's program. The Centers for Disease Control and Prevention reports that norovirus infections are sweeping the United States right now. While all regions have seen an uptick, the Northeast region has been hit in a particularly hard way. So the question is, what is norovirus and how can you protect yourself? Well, joining me today to look at these questions and more is Adriana Glenn, PhD. Dr. Glenn is an assistant professor in the School of Nursing at George Washington University. Dr. Glenn, welcome to the show, ma'am.
Thank you for having me.
You bet. So I guess the main question to start out with is, what is norovirus?
Great. So norovirus is actually a group or strain of viruses that cause acute gastrointestinal illness, or otherwise acute GI, which is basically the stomach flu. And the interesting thing about this virus, so viruses are often named for the places that the outbreak starts. So this outbreak of norovirus was first identified in the late 60s in Norwalk, Ohio. So it was actually called the Norwalk or Norwalk-like strain or virus, but we've tried to move away from naming viruses after the places of origin for obvious reasons.
So how common is norovirus, both here in the States and globally?
It's incredibly common. It's the leading cause of acute GI illness in people here in the United States. All ages are impacted, and it's really contagious. So most of the time, we're kind of in the thick of the season in terms of when things happen with this virus. But it occurs from like November through April is when we see it here in the United States. When there are new strains identified in the Norwalk virus family, if you will, you can see up to 50% more illness in that year of the new virus. And it's a disease that impacts the old and the young. So kids less than 5 and people generally like 85 plus will have more problems, but let's just say, 65 and over. Mm-hmm. And then these are the people that we see in the emergency rooms or have to go to the clinic. So I actually pulled up some interesting stats from the CDC. And according to the CDC, there are over 900 deaths, mostly among people over age 65, mm-hmm. and over 100,000 hospitalizations, 465,000 visits to the emergency room, and about 2 million clinic visits annually, with about 1 million being pediatric level visits. On a global scale, I think you were asking about that. It's the leading cause of death. Acute GI illness, not death. Forgive me for that. So affecting about 685 million people worldwide. And about 200 million cases are in kids less than 5. So once again, we see it in that younger population. But for children in developing nations, this could cause them to die. Upwards of 50,000 kids die globally. And it's mainly due to the fact that they are maybe in a malnourished state or dehydration.
So how do people contract this incredibly contagious virus? I mean, we hear about it on cruise ships a lot, yeah. but right now it's spreading pretty heartily across the country, and particularly in the Northeast. How do you contract it?
Yeah, so most people are infected through direct contact, meaning that they've either shared food or drink, or somebody's caring for someone that has the illness. So that's the vast majority of the cases. Although this is also in terms of it's very contagious through food, like foodborne illness.
Mhm.
You can get it through food. So when you've got people that are caring for people and they're not washing their hands, they can get it. And then also this is not as common, but indirect contact as well. So somebody who's infected touches a doorknob, you touch the doorknob and then you don't wash your hands. And so, like you've noted, we were hearing a lot about norovirus outbreak throughout the United States and on cruise ships. So if you think about it, think about, like, when I think about the cruise ship, think about the number of people in a very confined space touching things, not washing their hands, food sitting out. Like, it's just they're sharing food, they're sharing drink, alcohol a lot of times, which impacts judgment and people's behaviors. And so it's just like the ideal place for an infectious disease to like occur.
So, in the typical patient, what are the symptoms?
Sure. So, since this is a GI illness, you're going to see GI type symptoms. So, like a stomach ache, nausea, vomiting, some diarrhea. Sometimes people will have a low grade fever, so less than 100, but they don't always have to have a fever. It's generally viewed as a very self limiting illness lasting from 1 to 3 days. And when I say self limiting, I mean, like, you push yourself as much as you can do.
Mhm. And after you contract the virus, how long till symptoms actually appear?
About 1 to 2 days after
Yeah.
you've been in contact with the infection. And, based upon the person's, most people are going to be able to manage this no problem. But based upon, if you have a weakened immune system, or like I said, if you're old or young, these are the people that wind up maybe needing to go to a clinic and having a visit, because oftentimes with these GI illnesses, what happens, people don't feel like they want to eat or drink. Eating is not as crucial as drinking. So if you're not hydrated, that just sets you up to mess up your body chemistry and have a whole lot of problems.
Right. And so becoming dehydrated, this leads to various complications,
Correct.
which
Yeah.
is not super common with norovirus, but it can happen. Yeah.
Correct. Hmm.
Yeah. What about diagnosis and treatment? Is there, can you just send a sample to LabCorp and get it done? Or, I mean, how does that work?
Usually, when the patient presents and they're describing what they have, we just kind of base it. I'm also a nurse practitioner and I still actively practice, so we just kind of go by what the patient is sharing with us. So unless the person, maybe it has a compromised immune system, we can send off a stool sample, ideally within that acute phase of 1 to 3 days.
Mhm.
So we can send that stool sample off to LabCorp.
And concerning treatment, it's just like you said, it's self-limiting. So, is there any time you would treat?
Yeah, so what we want people to do when they have this particular virus or anything that's causing them to have GI upset. So I didn't really explain, when somebody has acute gastroenteritis, it's inflammation of the intestines. It sounds worse than it really is. It's just very uncomfortable for people most of the time. And I also want to note too, the diarrhea, there's no blood in the diarrhea, because there are some bacteria and viruses that can cause you to have bloody diarrhea. We
Right.
do not see blood in the diarrhea with norovirus. So basically, it's rehydrating with oral rehydration, things like Gatorade, Powerade, Pedialyte, water,
Mhm.
broths. Um, Not really juice or sugary drinks, because that can really aggravate the diarrhea, and not really caffeinated drinks as well, because that can act as a diuretic, so it's kind of
Right.
defeats the purpose.
Is there any situation where you would recommend seeing a healthcare provider?
Yes, if somebody cannot keep liquids down, like I said, you'll be okay for a couple days without food. But if you are not able to tolerate liquids, it'd be important to see the provider, because sometimes the provider does have to prescribe an antiemetic, or a drug that against nausea, or sometimes they might have to give you a medication to help with the diarrhea. Um, so those would be, if you are not able to keep things down, that's when you need to see a provider.
Okay.
And when people are taking, we're talking sips. We're not talking about sitting there drinking 8 ounces in one sitting. It's like every 30 minutes you're taking, maybe a couple of tablespoons of fluid. If you can keep that down, you're gonna be okay.
Yeah. Finally, probably the most important thing is, let's talk about prevention.
Mhm.
Um, what can be done to reduce the risk of getting infected? especially in this time of the year.
I cannot stress this enough. It's really important to wash your hands. 2 rounds of happy birthday is about 20 seconds, which is what we advise for people in terms of hand washing. Making sure that, if you're taking, before you go to the bathroom, before you deal with food, like you just should be washing your hands. I can't stress that enough. The actual norovirus can be in poop, if you will, for up to 2 weeks. So, if you're taking care of somebody that, your loved one has it, you better be very diligent with washing your hands. I'd also like to note that hand sanitizers are not really as effective for the norovirus, which is why, once again, we go back to the cruise ships. They're really good about squirting out that hand sanitizer as soon as you're getting ready to go in the main dining room or different areas on the ship. But really, the best thing is good old fashioned soap and water. The other thing, if you're dealing with people who are in your household that are sick, making sure you disinfect surfaces with a bleach solution, which is like 1 cup of bleach to a gallon of water. And then we do know, like I talked about it is foodborne. So shellfish, if it's coming from contaminated water, which we would have no way of knowing that, but we would have a way of knowing if the food was cooked. So you want to have food that's cooked to 145 degrees at least. Sometimes if you steam food, it's not going to be long enough to kill the virus. So it's kind of a little bit of a hardy virus. And then staying home when you're sick. I talked about the fact that people are carrying that virus around in their stool, and trying not to, if you yourself are sick, try not to make dinner for the rest of your family or breakfast or lunch or whatever, really doing that. And then also, if you're caring for people that have the virus and there's poop or vomit on the linen, making sure that the linen is washed in very hot water and you are using rubber gloves or some type of other glove. Yep.
Oh, some great advice. Dr. Glenn, any final thoughts on norovirus? Anything I might have missed asking?
No, it was great. Alex, wash your hands.
Wash
Everybody
your
needs
hands.
washing their hands. That cuts down
Soap
on
and
so
water.
many
Soap and
things.
water.
Soap and water,
Soap and water.
hand sanitizer is okay, but really as soon as you can get to a faucet, wash your hands.
Yeah, very good. Well, I wanted to thank you, Dr. Adriana Glenn, for sharing your time and expertise. Thank you, ma'am. I appreciate
Thank
it.
you so much. Thank you for having me, and have a great day.
You also.
Bye.